I'm going to give you a very strange question today. Do you know when you need to be concerned post cancer? What are the 3 red flags? And how do you realize that this is the time I need to visit a doctor? And do you know you don't need to visit your oncologist, but there are special onco physiotherapists. So, yes, there are physiotherapists which are basically only for post cancer cases. So, today, our guest for today is Dr. Dipal Shah. Welcome, Dr. Dipal, to MLS Podcasts.
Thank you so much, Dr. Sachi. It is always nice talking with you, and today we are discussing a special topic like physiotherapy post cancer. So many are not aware like what is the role of physiotherapy or why physiotherapy is needed and when it is needed after cancer. So mainly there are certain complications which can affect the quality of life of cancer survivor even when the treatment has been finished, like surgery, chemotherapy and radiation therapy. There are certain side effects of the treatment itself which affects the quality of life. So we need to treat and manage these complications, so that the survivor can have the same quality of life again after cancer also.
What are the signs that cancer survivors need to look for? Not just after a few years, but immediately post the cancer treatment.
So there are many complications, but as you mentioned, there are 3 main symptoms which one should be very careful about is any kind of pain in the body, whether it is related to the area of cancer or not, but any kind of unusual pain should be seen as a red flag. The next thing is any kind of swelling, especially lymphedema, which is the swelling of arm and hands post breast cancer surgery, because lymph nodes are removed. So sometimes it happens immediately after surgery, sometimes after some years of surgery, patient comes with swelling of arm. So it is a red flag. So as soon as you notice that there is slightest of swelling in arm, one should consult oncophysiotherapist, and it can be easily prevented and managed if it is treated and addressed at the right time, that is immediately after surgery.
Okay, I remember that because my mother is a breast cancer survivor and she was told to roll rotis. She said that rolling rotis is one of the best exercises to prevent lymphadenema. She is, I think, now almost 4 or 5 years post cancer and she's never had a swelling in her arm.
Okay.
So I know that this is very important. So thank you. And you said there are 3 red flags.
Yes.
Which is the third one?
The third one is stiffness or
Okay.
loss of mobility and flexibility. Mainly it is seen after radiation therapy, because radiation affects the muscles and soft tissues. So it creates tightness anywhere in the body, which part is treated for radiation. Mostly it is there.
So that
after
is why you're
radiation.
saying immediately post cancer they should go for physiotherapy.
Yes, before the radiation starts, if one
before
can,
the radiation starts,
yes,
okay.
that is the best time to start physiotherapy, because it will prevent the complications of radiation therapy.
I see.
Once the radiation has taken care of, and then patient already comes with the stiffness and tightness, which becomes difficult later on to treat, and it becomes
so if physiotherapy
troublesome.
is going on, then it is easier to do even when radiation therapy is going on.
Many patients I see immediately after surgery, that is the ideal time, and the radiation period is also very pain free and smooth, and after radiation also they are fine. So they don't need to.
This is just breast cancer, or it's cervical cancer, or any cancer in the body?
See, mainly the role of physiotherapy is there in each of cancer to prevent secondary complications like cardiopulmonary, to maintain cardiopulmonary endurance, to maintain their quality of life. But mainly we see like in breast cancer, as I mentioned, then lung cancer, which is again very common nowadays, and oral cancer. So what happens after the surgery has been done? They get stiffness of the mouth, and they are not able to eat. The mouth opening is restricted. So if immediately after surgery, after the healing has taken care of, if we start physiotherapy, we can help them in mouth opening. So it is not restricted, otherwise after radiation it again becomes little bit difficult to do the same. So, and even after radiation, they need mouth opening exercises.
As a prosthodontist, I understand, and I am a maxillofacial prosthodontist.
If within a year it is treated, they get 80 to 90% opening. If treated at
That
right
would be a boon
time,
for us also as
definitely,
dentists.
because cancer has been removed. But what about your,
Function.
yes, daily routine and functional
And I return
life?
aesthetics. I try to return function, but I think what you are saying is a very, very good option. That immediately post cancer, we must visit a physiotherapist who is trained specially for post cancer cases.
Definitely. So it is a teamwork basically. We also, work in, it is a team effort. Like we work with oncosurgeon, oncologist. So we,
But I think it's better immediately after cancer, once the treatment has been framed out, the visit to the oncologist is not that many. But a visit to you should be
yes.
there in their itinerary. That
Yes,
is what you are
definitely.
saying,
Yes,
right?
definitely. They have done their work, they have given life to you, but whatever years you have, we give life to the years.
So, tell us about your gymless fitness routine, Dr. Deepal.
So this came into my mind when when many females come to me, female patients with different kind of pains like back pain, neck pain, knee pain, which is very common after a certain age. But earlier it was like after 60 we used to get these patients. Nowadays after 30, 40, around this age, I'm getting patients which one or the other pains. So what happens is they are not able to do any kind of exercise at home, and they cannot go to gym also. And after 35, when menopause age starts coming, changes start developing in the body. So it affects the joints and muscles, you must be knowing. So if they don't work out, strength training is must for each of us.
But that is
And
the period in their lives when they don't have that much time. Children are probably in board exams, or they are having such a hectic life that family needs them. So going to the gym becomes a very difficult option.
and
So,
also it leads to one or other kind of injuries also,
oh,
because gym injuries are very common.
okay.
So it completely, otherwise you have to stop completely doing
Yeah,
all the
because the gym
exercises.
itself is pretty expensive if you go in for an
Not
year's
only expensive, but
subscription. So
maybe,
nobody goes in for
yes,
PT.
yes,
They don't
definitely.
take the therapy of the trainer, that personal trainer. Most people don't opt
Yes,
for.
and
So that's where
each
the
one has different kind of body structure,
okay.
different flexibility, different strength. So what we do is we do fitness according to physio, with physio.
Okay.
So we know what is your strength,
So
how
that's
is
how
your
gymless.
flexibility.
So you
Yes,
don't require any
definitely.
of the paraphernalia which is available in the gym. Okay.
Definitely. We use minimum equipments which maybe you already have at home
Home.
only.
Okay.
So better than doing nothing. At least you start and prepare your body. Even if you want to go to gym, first prepare your body to go to the gym, so that there are less chances of any kind of injury. Second thing is, if there is any minor pain, in your body already, so we take care of that along with the fitness exercises.
And this can be done from the confines of home.
Definitely, easily, and it is available online also.
Okay. And you can get fitness online.
Yes, definitely. So easy to do. You don't need to go anywhere, and from the comfort your home from your home
So you
at
don't have to
your
take time from a busy
convenience.
schedule. You can do it.
Definitely,
Okay.
definitely. So basically, there are many benefits, but main benefits are it is pain free. So we have a mentality. If you want to
Dukh se.
gain strength, it should be paining, then only you will gain the strength. It is not necessary. It is pain free, it is injury free, and you get full body workout from your home.
Even the physiotherapy post cancer, that can be given or meted out online, or for that does the patient have to come to your place?
Definitely it is very easy to do online,
Okay.
because cancer patients, they may not be able to travel all the time and come to the clinic, and they don't need to actually. If it is done immediately after the cancer treatment, hardly any guidance or sessions are required, and they can easily manage at home.
And most physiotherapists, they also do treatment post orthopedic care, then there is post spinal treatment care. So this I think requires special machines and sometimes those hot wax treatments, etc. So do you also offer all these in your clinic?
Yes, yes. See, basically, I have done masters in cardiopulmonary conditions,
Okay.
and I'm practicing since 20 years now.
Must have been classic for you at COVID. Because COVID is basically a
yes,
cardiopulmonary
yes,
condition.
yes,
So,
definitely. So nowadays we all need this, even after any kind of, just to prevent also, eh, after any kind of surgery, you need physio.
okay, any surgery.
Any surgery,
It
because
may
it
be
is
just be a
going
finger ligament repair.
anything,
Okay,
because your cardiopulmonary status is getting affected,
okay.
because rest period is given or whatever surgical procedure has been done. If you want to get full recovery, faster recovery, then definitely you should, at least one visit of physiotherapist is a must. So
When should the people be worried when the doctor tells you we can't do your surgery because of this? What parameter is it?
there are many parameters actually, depending on the age factor. That is also again, because if surgery requires to give anesthesia, anesthesia is going to affect the cardiopulmonary, mainly lungs. So if
Ah,
your capacity is down, you must have heard sometimes during the surgery patient does not survive
yes,
because of
true.
these parameters. If they are not taken care of, then that
So
is
this
why
can be
sometimes,
improved with the help of physiotherapy before the surgery?
definitely, yes,
And how long
physiotherapy,
would it take?
like it depends, it differs from patient to patient. If patient is young, even with minimum, signs and symptoms, then it is easy, like hardly 4-5, within 4-5 sessions, we
Okay,
can
it's that
manage
less.
that
So if
less.
it's not an emergency surgery and the parameter is not good, just 4 to 5 sessions with you will prepare them for a
Yes,
surgery
yes,
as well.
and especially even if one session is done prior the surgeries, it helps them recover faster post surgery.
That's wonderful.
Like even if you are going for total knee replacement, say, okay, it is not an emergency surgery,
It
right?
can be planned.
Yes. So before surgery, if physiotherapy is given, many patients feel like
The
the recovery
physiotherapy is
is so,
afterwards, yeah.
yes,
No.
because the muscle strength is there already, they have changed the joint, but what about the muscles and ligaments?
So physiotherapy should ideally be started before the
Before
surgery
surgery.
is planned as
That
well.
is the
So
ideal
that
time.
is,
Same thing is for cancer, but when cancer, we need to first focus on surgery. So as soon as the surgery part has been done, immediately physiotherapy sessions should be started. Definitely it differs from patient to patient, the condition of the patient and what type of cancer is there, but still it is ideal to start immediately after surgery.
so
Definitely.
anybody who is thinking of any planned surgeries like knee replacements needs to visit you before they actually go in for the surgery, right? To know whether they are, I mean, if it's an emergency, it's an emergency. They don't have the time to come to you. But if
Right.
it's not an emergency, I
Then
think an
definitely,
appointment
yes,
with you would
yes,
definitely make
yes.
sense.
See, I would like to mention is physiotherapy is there since World War II. Okay, it was at that time introduced to rehabilitate the soldiers,
Soldiers.
right? But nowadays, I think each and everyone knows the value of physiotherapy. So we know the value of exercise. We know the value of fitness. What our role is, many of us still believe that if I have a problem or pain, then only I need to go for physiotherapy. That is the mindset, right?
Yeah.
What we are encouraging now is, like as I told you about fitness, like women should start strength training after 35. They should not wait for some pain or problem or disease to come and then start, because strength training helps in all preventing all the joint pains, and plus even it works in monitoring and managing diabetes and blood pressure.
That's wonderful, Dr.
So
Dipal.
now, yes, I have this fitness, women's health and cancer. That is what I am specializing in, and I want to help them
Do
as
you
much
still
as possible.
freelance or are you available only at your clinic now?
I am available at my clinic. I am a physiotherapist at Rajpath Club also, associated with the club.
Okay.
And I am working with a clinic where we do holistic cancer care.
Where exactly is that?
It is located on near Manik Bagh,
Okay.
where oncosurgeon and emotional health counselor, homeopathic doctor is also there. So it is a
But with
team
your
work.
number, they can actually
Yes,
connect with
yes,
that
yes,
place as well.
yes,
And
yes.
this is at what time of the day?
We are available there at every Friday. On every Friday we are
Okay, so the
there.
holistic
So
center is only on Fridays.
yes,
Your clinic, it's
it's
24/7.
it is open from 8 to 8.
Okay.
And we treat all these conditions. We have latest and advanced technology available at my clinic, so we can
Do you
treat,
have some kind of assistance also?
yes, we have a
So,
team of
so
5
okay, so
physiotherapists.
more than one person can be
Yes,
treated at a
more
time.
than
All
one
right.
person, and we focus mainly on personalized exercise plan, as I told you, because only machines is also
Will
not a
help you for a small
solution.
period of time.
Yes.
After that, the person should be able to continue at home.
Yes.
So you basically concentrate on that. And initially you help them, and then
Yes.
later on you convert them to do it at home.
My motto is everyone should be independent.
Independent. That's wonderful.
So what I do is my main focus now is for preventive physiotherapy. That is what I was coming to, that physiotherapy has a role in each and every condition. So if you start at the right time, like it can prevent this diabetes and blood pressure also, or it can at least reduce the medicines or the further complications, of this lifestyle diseases. So it has a very huge role to play. So prevention is better than cure always, and
Always. We had a doctor before you also, and her also saying was that only, that we are there here to treat. But if I can teach you how to
yes,
prevent
yes,
coming to me, then I think I'm a better doctor. So I think that is the
definitely.
message you're giving
That is the
everybody.
message.
And if there's anything else that you'd like to share, because you've shared wonderful information today, which I'm sure our subscribers are going to love. So if there's anything, that special message you have for our subscribers, please do share with us.
If you love yourself, then give at least 30 to 45 minutes of exercises daily. Give this time to yourself, Love yourself, love your body, whatever God has given you.
That's
It is
the
a
biggest
gift.
giveaway that I am taking from here today.
It is a gift by God. Unless you lose something, you don't realize the value. So if God has given you good health, it is your
Agreed.
responsibility to maintain it. So please maintain your body, love yourself, and do exercise regularly.
Thank you. Thank you very much, Dr. Dipal. And that was all from us today.